Hello everyone, Dr. Beth here and welcome to another episode of The More You Know. For the month of October, we're going to be taking a deep dive into diabetes. So diabetes is number one killers in the United States, and especially when we're looking at seniors, it affects 33% of seniors, and that number is only expected to grow. So diabetes is a disease characterized by having too much sugar in the blood. I think most people know that that's kind of the underlying characteristic of the disease, the thing that kind of defines it. So in this series, we're going to really focus on diabetes type 2. So diabetes type 2 focuses on insulin resistance. So the body's not able to use or process insulin the way it's supposed to. This is compared to diabetes type 1, which is decreased insulin production, where the body's not able to make any insulin or enough insulin to help manage the sugars. But since diabetes type 2 is the most common type affecting seniors, that's what we'll be focusing on. So normally after we eat a meal, our body breaks down the lovely, delicious food that we eat into smaller things, including sugars. When that happens, our pancreas releases insulin to help take the sugar out of the blood and bring it into the cells where it can be stored for fuel later and used as energy to fuel our bodies during the day. So in diabetes type 2, our body has become insulin resistant, meaning that the body cannot effectively use the insulin that's in our bodies. So the bad news about having increased sugars in your blood when the insulin doesn't work as well is that it can wreak havoc on our body. It can actually destroy healthy tissue. And all of this is because there's a lot of cells in our body that are really sensitive to increased levels of sugar. So in particular, I think about our nerves and our brain. When there's too much sugar around them, they start to break down. The other thing to think about is glucose is actually a really large molecule, and so it can really cause damage to organs which have smaller blood vessels, like our eyes and our kidneys. So some of the most common complications from having too much sugar in the body are loss of vision, neuropathy, kidney disease, poor circulation, which can lead to wounds and amputations, and increased risk of cardiovascular events, so heart attack and stroke. So this is a really big concern and something that we definitely want to figure out how to prioritize and prioritize either preventing developing diabetes or manage it if we have it. So the good news is diabetes is considered a lifestyle disease, meaning the choices that we make every single day in our diet and our exercise really do affect the likelihood of us developing it and of it getting worse long term. So by making changes to what we eat, by making changes to how we move or how much we exercise every day, we absolutely have the ability to control and manage this disease long term. So we're going to take a deeper dive into all of those. We'll be covering aerobic exercise, strength exercise, and of course diet over the rest of the month. So stay tuned.